Now to a story you'll only see right here on ABC4 News. In early June, top state health officials essentially demoted Utah's public health lab director, Robyn Atkinson-Dunn. The move came as state health officials witnessed a rapid increase in positive COVID-19 cases and as the demand for increased testing surged. ABC4 News investigator Jason Wynn sat down exclusively with the former lab director. He's live in studio now with the story. Jason.
Glenn, Robyn Atkinson-Dunn was removed from her post at a time when she was not comfortable sending COVID-19 samples to a lab found out of compliance by federal inspectors. In May, federal regulators cited Timpanogos Regional Hospital's lab for not being in compliance with the Clinical Laboratory Improvement Amendments, or CLIA compliance, basically federal certification guidelines for labs. At the time, the hospital, operated by Mountain Star Healthcare, a client of ABC4 News, had been enlisted to help with the state's coronavirus testing. ABC4 News obtained the federal audit conducted by the Centers for Medicare and Medicaid Services, or CMS, a division of the Department of Health and Human Services. In the audit, investigators found, among other deficiencies, that the lab at Timpanogos Regional Hospital, quote, failed to ensure positive identification and optimum integrity of patient specimens from the time of collection through the completion of testing and reporting of results. In one instance, auditors were told by a lab worker that leaking referral specimens had been tested for COVID-19 and that collection sites responsible for leaking specimens were not identified or contacted. The report also found the laboratory failed to follow manufacturer's instructions for sample storage and transport, like refrigerating the specimen at 2 to -8 degrees Celsius and shipping overnight on an ice pack. 2 lab employees told investigators that all referral specimens sent to the laboratory for COVID-19 testing, the samples were shipped to the laboratory on a refrigerator pack, not an ice pack. At the time of the inspection, the federal inspector found fault with 6 lab processes and procedures, or lack thereof.
I think the results are valid, that there were some discrepancies. The question always comes down to why were those discrepancies there? And that was part of the conversations we were having, was to try to delve into those discrepancies, whether it was on Timpanogos or on the public health lab.
In a response dated June 8th, Timpanogos Regional Lab Director Blair McGurk told federal auditors, quote, "It is our understanding that the state of Utah, via the Department of Health, developed all of the public testing processes and protocols. Public testing is carried out by Test Utah, a statewide testing initiative launched by several Utah tech companies to help the state perform 3,000 tests a day. The Test Utah project came under fire in early May when infectious disease experts began questioning the accuracy of their tests because their positive test results were far below the state's and other labs."
The public health lab at the time was trying to work with Timpanogos to try to understand some of the allegations that had been made as far as lower positivity rates from their testing, things of that nature.
Timpanogos Regional Hospital officials declined an on-camera interview, but say there were daily and weekly meetings while Test Utah was in its early stages of development. The attendees of those meetings included hospital and lab representatives involved in COVID-19 testing, representatives from various Silicon Slopes partners, and representatives from the Utah Department of Health, including Robyn Atkinson-Dunn and other representatives from the state lab on many occasions.
You were the director at the time, so did you give the hospital and the lab any type of guidance on how to perform COVID-19 tests for Test Utah?
Yeah, that's a great question. No, it didn't. It's really interesting that that's how they would portray it. In my opinion, the only guidance we gave was statewide, and it was mostly guidance from our laboratory regarding how to collect samples, how to do testing. It's my opinion that what they're driving at in this document is that because of the way the testing was set up with Test Utah, with all the different players, with Qualtrics and reporting, that they feel that somehow the lab, myself, even others within the Department of Health were responsible for setting up their procedures and their policies. But no, at no time did I give them any type of guidance on how to do testing, how to set it up, how it should be processed. And I frankly have no authority to do that.
I asked the State of Utah Department of Health about this. Officials would not go on camera, but provided this response stating, Robyn was involved in helping to establish guidance and protocol for all COVID testing in Utah, including through the Test Utah program. Timpanogos Lab Director Blair McGurk, in a response to the audit, states, thus procedures established and governed by the Utah Department of Health, here an agent of CMS for public COVID-19 testing, have driven the processes for which the lab is now being cited.
There were some claims that because we are an agent of CMS, which the laboratory is not, that we were somehow driving their procedures and their policies, and that's just not true.
The Orem Hospital's response to the federal audit also indicated their lab had issues in putting COVID-19 data into the state system because of a software program. The hospital tells ABC4 News this access was granted on June 8, 2020 in order to meet the concern raised in the CLIA report. The Utah Department of Health granted permission for the lab to gain access to additional information. June 8th was also the day Atkinson-Dunn was removed from her duties, but state officials say it was a personnel matter.
Robyn, there's going to be some that say that you may be a disgruntled employee by coming forward and talking.
Sure.
Can you respond to that?
Yeah, I mean, I think disgruntled's a strong word. I'm obviously hurt by the way things happened. To be shockingly and abruptly removed from a position that I've had for 8.5 years, with, pretty glowing performance reviews prior to this, not having any documented evidence that anything had gone wrong. It was hurtful, and so it does leave you to question why. And so you just try to put the dots together and try to understand what happened.
Timpanogos Regional Hospital says it continues to provide accurate testing results for patients in our community. The accuracy of the COVID-19 testing done at Timpanogos Regional Hospital has now been verified on multiple occasions. The Test Utah lab at Timpanogos Regional Hospital is in full compliance with federal standards and has responded to the recommended suggestions identified in its recent lab audit. And one final note here, after talking with CLIA inspectors, they tell me they should have all of their findings within a month. That could include fines and possibly the loss of Timpanogos Regional's CLIA certification. I'm Jason Wynn in the newsroom, ABC4 News.
All right, much more to come on this story. Thank you, Jason.